It is the time of year for all kinds of sniffles, but are they COVID? Are they RSV? Is it a sign of the flu, or is it just a cold, or maybe it's allergies?
Great questions, Candace. We welcome in Dr. Monalisa Tailor. She joins us on the show. Welcome to the show. So glad to have you.
Thank you for having me here today.
Well, okay, so let's get right to it.
Yep.
How do you tell the difference in the symptoms? Is it RSV, COVID, flu, or allergies? Because from time to time, we have people in the office and they're like, it's just allergies. And I'm like, I'm no medical professional, but it looks like your problem's worse than allergies.
Yeah, and this is where it gets hard because a lot of these symptoms do overlap. So when it comes to allergies, we're nearing the end of the ragweed season with our outdoor allergens. When November rolls around, we'll be seeing more indoor allergens as well. So allergies tend to cause more like runny nose symptoms, itchy eyes, maybe some stuffy nose as well.
Okay.
And people will typically tell me, I always get an infection this time of the year. So if it's something along those lines, probably allergies. Now, when it comes to like colds and flu and COVID, this is where it gets a bit more complicated. Now, flu makes you sick fast. You get sick within the first 1 to 2 days. You're going to have fevers, you're going to have muscle aches, you're going to have cough, and you want to lie down because you are feeling so tired with what the virus is doing to your body. So you're going to know pretty quick if you're sick with that. Now, when it comes to COVID and a cold, this is also fun. COVID symptoms start at about 3 to 4 days in. And I know we're all familiar with the fever, the fatigue. There's muscle aches there too, loss of smell, loss of taste. Now, the interesting part has been there have been so many different versions of the virus that you might see more sore throat, sneezing with this. You might have some nausea, diarrhea as well, shortness of breath for my folks who haven't gotten a new vaccine lately. You may have that shortness of breath again. Again, those symptoms are going to be at about day 4.
What do you tell people about when they should stay home from work and how long?
Well, and if you think that these symptoms are the flu, like I said, that comes on very
if you
quickly.
Have a fever and aches.
Yeah, fever, aches, sore throat. Like, if you're not feeling good, stay home because you don't want to get anyone else sick. And we've learned that over the last 3 years. If you do have to go somewhere, because some of us may not have the luxury of being able to take that time off, put a mask on. Keep your hands clean, because touching our faces, touching our nose, shaking hands, doing all those things, that's the way we spread viruses.
So the number one way to prevent illness, washing your hands?
Washing your hands, wearing a mask if you're not feeling well. I would do both of those things. And I do the washing my hands a lot during the day.
I say to my kids all the time, wash your hands, don't touch your face. Wash your hands, don't touch your face. I say it all the time.
Pretty much.
Just to try to avoid spreading the sickness. Well, thank you for coming and just kind of laying out the different ways to evaluate and what we can do to keep ourselves from getting sick. That's important. Thank you.
No problem.